Hello, welcome to Rappler Talk. I'm Marites Vitug, and joining us is Johanna Son, a Filipina journalist in Bangkok. She's been based there for 20 years. She's the founder and editor of Reporting ASEAN program. She has covered Thailand and the rest of ASEAN for a long, long time. So we're going to talk to Joanna about actually how Thailand has contained or is containing the virus. Welcome to Rappler Talk, Joanna.
Yeah, hi Marites. Morning.
Thank you for joining us. So there's a bit of good news from Thailand. As of yesterday, May 26, Thailand had no new deaths and a single digit rise in new cases. So Joanna,
Yeah.
how was Thailand or how is Thailand containing the virus?
I think now people are a bit more relaxed. I mean, and we there were a bit of stressful times as well. But I was looking yesterday at for example, of the shape of the curve for the new cases. So it's like this, peak, and then now it's here. Active cases were like this, and now it's like this because now they only have 50 something people in the hospital, and recovery rate is 90 something percent. New cases since let's say they started unlocking and allowing like some activities. So that would have been May 3. Since May 3 till today, the new cases have hovered between 0 to 3, 4, something like that. So, which I think kind of everybody's like watching because of this fear that once we start opening up, what will we see and all of that kind. So that's kind of where the figures are right now.
So that's good news for you and the rest of the people there in Thailand, right?
Yes, but I think a lot of people, I think, are like me when I like check with my friends that we still just don't go out unless there's a reason. You don't like just say, "Let me go to the mall today," even if you have no purpose, kind of thing. So, and I think the government, while they allowed a couple of things, they keep saying every day, nonstop, that stay home as much as you can, stay home as much as you can. So a lot of it is, I think, getting people to what's the word, to imbibe that habit that you don't like just let all your guard down. Yeah.
So is Bangkok open? The malls are open. I've seen some photos, but
Yeah.
what remains closed?
Schools haven't opened yet. There's a big discussion now. I read yesterday that they're trying to see if they can restart in July because usually the terms here open would have been open by now May, so it's been pushed back a bit. And I know because I've talked to like some teacher friends that they're a bit anxious about how do you do physical distancing. I mean, by nature and schools. So I think it needs to be discussed. But also the big arenas are not open, like the boxing stadiums, which became a cluster actually. So people kind of have this like boxing stadium kind of thing. Gyms aren't open yet for like group classes. Yeah. The next round of opening, which is the third step, is for the end of May. So June, basically, yeah.
What do you expect to happen in this third phase of the reopening?
Third phase, I think they're going to open the ones they classified as like higher risk because they classified activities into low, medium, and high risk. So they're going to allow some of the high risk and then test. And all the time they keep saying in the daily briefings that if the numbers start to look worrisome, they will reverse easily. Yeah. And I think for me, I mean, maybe being a journalist, so I look at like what is their parameter, what are they looking at, etc. And so they have been able to say things like 3 a day, yeah, is acceptable to them. And then they said if the new daily information is 5 per million, they will start to clamp down again, and they will consider critical more than 10 per million. And I heard a doctor also the infectious diseases person say that he thinks Thailand can manage, like taking into consideration bed capacity, physicians, infrastructure, maybe up to 30 a day. with no like feeling that, of emergency too much, meaning 30 filling up beds. But he said more than that, we would like kind of say, wait a minute, wait a minute. So I think it helps the public know, right? You're also watching like what's okay, what's not okay. Yeah.
So you mean there is real data on the ground monitoring that they would easily know the number of new cases, as you said, when they reach the parameters are reached, let's say 10 per million, then they would reverse. So ibig sabihin, the data gathering is really good, efficient.
It does look like that. I mean, I think everybody, to some extent, like will say maybe it's more than that, maybe it's more than that, perhaps it's more than that. But what you find out is probably also an indicator of how they say that bigger set, right? And I think the next question is because the virus will be a virus, right? So it just continues to exist, right, and do what it does. But I think maybe the bigger issue is how you manage the cases because Singapore has a lot of cases, right? The most, but it also has 23 deaths. So, it kind of tells you something. What I'm saying is number of cases per se um, is dependent on many things. And Thailand, for example, is bordered by several countries by land, right? Unlike the Philippines, which is sea. Hmm.
So, Joanna, to what is there a single factor, or maybe what are the factors that have led to this, at least very reasonable or very positive con- positive news from Thailand? What is responsible for this?
I think there are probably like different ingredients for different countries, but I think what has helped Thailand is like there's the village health volunteers. So I was reading a bit more about the history. So supposedly there are like more than 1 million of them. Thailand has about 68, 69 million people. About more than 1 million of them, they're like your parang mix between a town crier and your ate, if you will, in a village. So they're from there, they know the people. And then in one story I read that it was, for example, one volunteer in Chiang Mai, in the north, who like was talking to a returnee from somewhere, and then she spotted that parang this person has symptoms, but sometimes the person's not sure himself or herself. So uh, the volunteer got the person to go to testing, for example, and he turned out to be positive. So the health officials were like quite thankful that you need this surveillance thing and to encourage people, teka lang, ganyan, ganyan, ganyan. So that has been, I think, in many ways a backbone that Thailand has been able to rely on, which is, I think, beyond issues like this pandemic, that problem, because there was the avian flu, there was SARS, right? And there was
Airs.
there was also HIV, right? So because I read that they started 1970 something or 1980. So parang there's a backbone that how do I say, transcends your current government, your current policies. Yeah, it's just the skeleton, which I think makes a difference too. Yeah.
So this maybe it's counterpart to the Philippines barangay health workers, although they're not as they have not been tapped yet in the Philippines. But so
Ah.
this village elders or village leaders, so they report to the there's there a city health center. They report cases or at least people with apparent symptoms to the rural health center.
I'm not sure if it's the rural state handle, but for sure it's the local government. And they're not only looking at problems, they are also very strong, it seems, on the preventive part. So there are a lot of information disseminations. They have posters. I saw pictures. They stick them on the doors so that people see them. And then she said that sometimes people, yeah, they read the news, they listen, but they want like a real person to ask like face to face. So they get asked questions about masks, about hand washing, and they repeat and repeat and repeat and repeat, which is I think important, no, for public health concerns at this point.
So also Thailand has been leading at least parts of Southeast Asia in terms of testing. So testing was a major or is a major strategy of Thailand
Uh,
as well.
yeah, I was working on the figures yesterday. So it's Singapore first, Brunei next, Malaysia the third, and then I think Thailand somewhere in the middle. So when you look at it, Thailand isn't very high on testing actually. I mean, not, Vietnam neither. It's just Vietnam's testing are not very different from
I
per million people figure, not very different from the Philippines. So that's why I'm saying that I think it's not, there's no magic pill like if you get only one thing right. And I want to share something I found quite useful from one of the briefings. We had the discussion with again the deputy, the person who gives the in the briefing team, also doctor, and he was saying that yes, he said many people like say testing, 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 and he says yes, it makes a difference. But he said beyond testing itself is the policies in testing. So like where do you invest? How do you choose? How do you use your testing? And he gave an example. He said, you cannot just mass test like everybody in your pool. And then he said like Thailand is also a developing country, even if it may be per capita income bigger than say the Philippines. But so he said you have to think where am I going to put my limited resources? And then he said he gave an example. He said in one incident that they felt maybe this is a cluster in Phuket, I think they said they tested parang 1 million people or no sorry like 1,000 people sorry, and only one or two were positive. So he said it teaches you how do you select. Then he said that cost them millions of baht. So you cannot, she said, you cannot just throw without a plan. Yeah.
So it's like testing as a means to survey. Because here, Professor Mahar Mangas has been advocating use tests parang randomly to
Random
survey.
yung kanya, oo.
Yes. Doon ba sa Thailand, random din yan?
Hindi siya random. Because they said that because I think there's maybe they also decide like, because I think at a certain point, like now, what has happened is, okay, it used to be the countries were all open, right? So there was traveling, etc., etc. So I think what's happened now is that countries like try to reduce the set of possible transmission channels, no, if you will. So you close your borders. So and then you try to work on your domestic transmission first. So Thailand is now very low, no, in domestic transmission. They even released a list of what are the most common sources at this point of the infections because they're tracing, no, they're tracing like they're doing contact tracing, etc. So most of them now are travel related. So they're trying to starve the domestic transmission part, right? And then maybe when it's safe, you can start discussing opening again or creating even like what Australia and New Zealand said, no, which is a travel bubble. So you I think that's kind of it. But maybe if you're having a hard time and you leave all these channels open, you have so many fronts, kind of, I guess, no.
So all international flights, no, most of international flights are closed, right? Except Joanna, the returning Thai
They
national.
extended it for another month, in fact, until June. So at a certain point, it was a lot of Thais were kind of like shocked in the sense that because when the government felt it wasn't ready, I think in late April, it wasn't ready, meaning to quarantine everybody who flies in. They actually stopped everybody, including Thai nationals, from returning. And then when they felt they could organize it, then they allowed. So now it's repatriation flights. They announce every day how many. I think there are like I heard yesterday like another 10, 15 like due. So now there are a lot every day, but all are going into quarantine.
So I see. So only the new cases are actually from the Thai, returning Thai nationals, right?
Um, a lot of them seem to be, and then they even listed. I just looked this morning. They even listed where they came from. So a lot were Indonesia, Malaysia, because I think also somewhere, maybe, remember there was a big Islamic event in
Yes.
April, I think, in the Tabligh. So I think some of them are from that, and because also Thailand has a border with Malaysia, no? And then the some are also obviously from flying because US and Europe. ganon. So, I mean, it's interesting. It's not perfect. And I think at the start, Thailand was a bit like, you could feel that people were like, where are we? Kind of, what are they going to do? Etc. Etc. So it was a bit of like that shaky part, if you will. But I think in the last month, because the cases here spiked in early March onward, and then began to ease during the new year, mid-April or so. So, and then and the figures now show that, and the government people have said it, but it's also reflected in a public opinion survey, YouGov, that 95% of people in Thailand wear masks now. And but I saw an interesting figure, Marites, in the global survey of how people feel, the level of fear that I could get it. The Philippines is tops.
Are we?
86%. Yeah, I'll do an infographic. 86%, the highest percentage of people who say they fear getting it is the Philippines. Which it's kind of okay. You can look at it in many ways. I mean, but you could use your fear, right? Meaning, how do you address this problem? I guess, yeah.
So where does Thailand fall in that survey?
It's not so high anymore. Vietnam was also high, but you see, maybe it's part of the vigilance. Maybe it fits the vigilance too, because they're already going to the beaches in Vietnam. You know, this consciousness that we can't be lax, right? Maybe is there. I thought it was interesting.
So, Joanna, earlier you mentioned contact tracing. That's
Yeah,
also one of the active
yeah.
ingredients in Thailand's approach. How do they do it? Do they use this network of health, I mean, of village people?
Ah, that's included. A lot, I must say, one thing that also struck me around Songkran. So, like New Year's everywhere, it's a typical time where people go home, right, to the provinces. And there was a time that was a time that the economy in Bangkok was shutting down. So people were not having work, meaning a lot of people felt wanted to and did go home to the provinces because there was nothing here. So when this thing began to happen, the pictures were like at the bus terminal, the buses were full. There was no safe distancing. It was like, oh my God. But you see, interesting is, so everybody went home, like that's around 13, 14, 15 April. So the people were bracing for like, oh my God, it's going to go to the provinces now. It didn't happen.
Oh,
The
why?
spike didn't happen. It's the volunteers. This is what the doctors were saying. Because they know everybody. They know who came back, right? And they will like visit, 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 and keep saying, keep saying, keep saying. So I think that to me is interesting from the perspective of you don't need a lot of millions, you don't need high technology, but it's actually common sense and looking at your social connections and maybe how you can use them. Yeah.
So these people who return to the provinces, were they told to quarantine themselves, or by
I
the?
don't think they were able to quarantine all that much. But I think that these people were like really going around and going around and going around and saying, and you know, so that it kind of helped because that you and not everybody can go see a doctor, ask a doctor, right? So they're kind of the bridge between, you know, they know a little, they're not doctors, but they know enough usually. They're also the ones who I read sometimes, if the person can't go to the doctor or it's not a good idea to go to the hospital, right? They bring some of the medications for chronic illnesses. Yeah, for
Wow.
diabetes, for hypertension.
So
Uh,
the this village network, they bring the medicines to the patients, but this is paid for by the government or by the by
well,
private.
there also is universal health coverage here, no? And I think I was looking at one more indicator, if I may, like World Bank on health expenditures per capita. This was as of just 2000 to 2017. The Philippines was 371 US per capita. Thailand was 670 per capita.
Wow. Oh,
So
well,
I mean, it's so I mean it's kind of like it's a bit like insurance, right? It's like the principle in health insurance. When things get bad, you want a system to rely on that is maybe immune to too much like partisanship or fluctuations in investment, no. And Thailand has, it's known for generic drug production. It is known for producing the antiretrovirals for HIV, right? And leading in terms of access, right? So now they are also working on a vaccine for COVID-19. And what to me, the very different element is, how do I say, the public health, the idea of public health, meaning health that is more easily accessed by the public, has very strong roots here. So, for example, the vaccine is being developed. They are doing, I think, monkeys. It's being worked on in a university lab, Chula University Lab. That's a public university. So it is not a drug company.
Wow. So this Chula
Because
Longkorn.
they're very strong. That she said this is not only it's about access. It's about access.
So is Chula Longkorn partnering with a foreign university or lab, or
I
is it just
didn't see it. I didn't see it in the short news article, but I did read the quote from the person in charge saying that, and also she makes a right point, which is that I think there's a bit too much focus on the vaccine, like it were inevitable. We don't know, right? Look what happened to the dengue vaccine, and that went through normal testing, not rushed, right? But he was saying, let's assume that a vaccine is developed. She said, if you think how many millions of that need to be made, right? You can't do that like overnight. So she said, developing countries need to think about where they can get, and maybe we should do our own. Yeah. I want to add that PPE, Thailand also made its own PPE. I saw it in a poster from public relations. So what I'm saying is kind of like, I don't know if I'm right. I kind of tested it with some people that, like in Thailand, like if I have a skill, let's say I'm good at making somtam, the papaya salad, right? And I need money, right? Usually what will happen, they'll think, how can I make this? I can make this. I can sell it in the street, right? So there's a kind of like a pragmatic approach that what can I do? Which is, I think, different from maybe I don't know, when I look at the Philippine discussion sometimes, I like keep asking I wonder if there's room to turn that, instead of focusing maybe on what I want to call maybe external things or blaming, you can think maybe about what can we do? Because as this doctor was telling you about, she also said that his remarks made me think that for developing countries, we have resource challenges, but it doesn't need to always like kill your creativity and your ideas and your fire. And then she said, a lot of it is common sense. A lot of it is public common sense that is based on understanding of public health and how people live. So when they were discussing the reopening, there's like a coordinated mechanism that handles it, as in many countries. They even talked about, Marites, like, will there be a queue in the toilet in the mall, and how are they going to prevent it? But it's a valid concern, right?
yes.
So yeah, they go to this. There's like that thing that like, yeah. So, I want to say, did you see the sticker? Can you see my sticker?
Yes, yes, yes.
Yeah. So
Oh, that,
now when you go to any store where they screen you get a sticker, meaning they already got your temperature. So if you go to several, there are several stickers in a day. Ganyan. It's that kind of thing.
so Joanna, basically, Thailand has really invested in public health in terms of um, research, R&D, hospitals, training. Is that what's looking at it at the big picture now? And you said in terms of per capita expense, no? Mas mataas ang Thailand and the Philippines.
Yeah. So I think it it makes you ask, like, in a sense, as a citizen, right? What what really matters, right? And these are like kind of very basic issues that you kind of look for. I think it's not magic that people look for, but I think it's a just a perception, at least, that there is a system that is not dependent on, other things. I mean, it's not perfect here either, but I think they kind of found their balance after, some a little time, because Thailand was the first case of COVID after China.
Oh,
The first case was reported here.
I
Yeah. And
see.
then it was doing not so bad, and then it kind of spiked, and then it like kind of now, yeah, hoping it continues.
So can we zoom out, Joanna, since you watch ASEAN? So if you were to, I don't know, assess which is the best performing in terms of containing the virus, I don't know, maybe just where they have very effective strategies
I
among
was
ASEAN.
thinking, if we thought about it as if you were the person and you were to choose where to
Where?
be,
Yes,
right?
good, good.
So I think the first thing is, first, obviously, you don't want to get sick. Second, if you do get it, you want to be sure that uh, you're not going to be left out there. So you also want to be maybe tested, or that it is diagnosed early enough, right? Because I think it seems it's a factor in, like, for example, Singapore. When you test early enough, hopefully your mortality rates are also lower, right? Your degree of severity, hopefully also lower. So that's the other value of testing, so that you get tested and that you can get not treated, because there's no cure, but you're given the health care that you need, and then you can if your recovery is faster, you are taken off the active list, right? Active cases, um, and then um, that you have a support system of some sort. In that sense, it's not necessarily, as we were saying, any one factor. If I look, for example, Singapore has 32,000 by now, maybe, cases, right? But 24 deaths.
Yes.
So, meaning, if you got sick in Singapore, you seem to have a pretty good chance, right, of being okay. In Vietnam, they, again, there's no magic numbers in the testing, but they locked down pretty early as well, and they seem to have all just followed it. And they have zero deaths until today. But I must qualify, because I was talking to somebody from Vietnam. It also depends how you define what is a COVID case. And this varies among the 10, 11 countries in Southeast Asia, which I think is a story people can look into, but it has not been examined so well. And what is the reporting system of each country? How do you classify something as a COVID case? Because in some medical environments, if your first complaint or problem is not COVID, you're not counted as a COVID case. So in the fatality counting in Vietnam, if you have other cases and it's not mainly the COVID, you are not a COVID case. So there's that thing to just remember. So, but they're officially at zero.
Yes.
So, but what did they do? It's a lot of. This was the lockdown. I think it was the physical distancing. It was not a
Contact
magic amount of testing,
and the quarantines and contact tracing.
and they were very early in quarantining
Yes,
everybody who flew
yes.
in, and they just gave it. Foreigners, they didn't care, any, just everybody. Yeah. So, and then in what's the
Malaysia.
other interesting case?
Malaysia,
Malaysia, they were really high at the first part.
yes, yeah.
Then they got overtaken by the
Singapore.
Philippines and Singapore. Yes. They have been discussing too this testing, but you can see from the graphs that Thailand and Malaysia's active cases have been clearly going like this since April. And if you look at the smaller countries, also interesting, like Laos, for example, um, people were kind of expecting, like, oh no, no, because they're not rich countries. There are questions about the health system. They share a border with China, with Thailand, with you know Vietnam. But maybe it's also population density, because population density elsewhere is lower than, say, I'm sure lower than the Philippines, right? And then my friend in Laos says that it looks like the government like really watched and then said, no, we cannot take this risk. It's like no, and like, because at one point in the measures of the lockdowns, Laos was first among the 10 countries. They had like 97% maximum, if you consider. So it's kind of, and Thailand never fully locked down. Never. So, but we have a curfew that's been shortened to 11 p.m. to 4 a.m. But so you kind of have to mix the right ingredients maybe to get what clicks in that country, I think, right? To get them to like follow you, don't, because whatever you say, I think, and with whatever your government is, even here, whatever your government is, you want the lockdowns to work,
Of course,
right?
yes. After all, we're the ones who are suffering. I mean, we cooperate. I think most in all ASEAN countries, citizens have cooperated in the lockdowns. But final question, Joanna, I'm just interested: are the street food, the food stalls open?
Oh.
No.
Well, the one near here, yes. Actually, there was traffic jam yesterday in the main street. And I mean, and listening to the sounds, like even if you're at home, you can listen to the sounds. And it was like very quiet for weeks, almost like Thai New Year, like almost like Holy Week in the Philippines level of quiet. And then you hear ambulance sirens, right? It gets me, they're like, and then in the last maybe 2 weeks, it's changed to like usual public sounds of cars, but it's not yet back to normal totally. But the buses also, they, I mean, they're there. But there's also social distancing in in the buses. Nakadraw sa sahig ang footprints or ang circle.
Saka
Yeah,
hindi
and some
pwedeng
buses have
tabi-tabi.
hand gel. And I was telling my friends, in 7-Eleven, there's a limit. Maliit lang 7-Eleven, right? But they have a limit on ilan people pwedeng pumasok. I mean, you enter, they force you to handle and they take your thermometer temperature. 7-Eleven yan, ah. So, I mean, there may be things we can just do. Maybe I was thinking, if you have a condominium complex, you just do it in your community. Kasi, I don't know. Yeah, a level of it is maybe we just have to do it that way.
Yes. So thank you so much, Joanna. It was really very instructive. And, being neighbors, Thailand, Philippines, we can
Uh,
learn from each other. But in terms of population, kasi Thailand is, I mean, smaller, much smaller. You're how many million?
Yeah, mga 68,
Oh,
70. Kasi naman, no, ang fertility rate natin hindi bumabagsak na dito. In fact, aging na magiging issue dito.
dito.
No,
Okay.
but Marites, when I moved here, in my stories, the two countries were almost the same
Yeah,
population.
don't depress us.
Yun naman, it just struck me.
I'm just joking.
No, I mean, I really hope things
Yeah.
get better because, I do the figures every day. So it's like I see it like, yeah.
Oo nga, nagbibit nga yung, tama yung survey, nagbibit talaga yung heart ko dito. Whether, when do we really return to office? I mean, it will start to normalize a bit in June dito sa Metro Manila.
Oh,
But of course,
okay. You
cautious.
see,
Cautious.
magiging matanggal yung magiging GCQ.
Yes, ang giging alphabet soup uli, GCQ, but very cautious. In fact, many offices will not return yet to work kasi magiging skeleton force pa rin. Let's see how it is. But thank you, Joanna, and we will stay in
Okay.
touch. And I will, for our viewers, you can go to Facebook, Reporting ASEAN page, so you can watch they do a daily monitor, right, of
So we
cases.
now look at like general trends and then testing figures, mortality analysis, and some public opinion things like how many people wear masks, how many people say they wash their hands more often, which, it's always good to remember to say, look at like what our neighbors are doing. Also, so you don't feel so alone.
Okay, so that will be a good guide for us reporting ASEAN. Thank you, Joanna, and thank you to
Thank
our
you, Marite.